Good afternoon and welcome to the latest in our series of interviews, Leaders in Medicine. Today it's my great pleasure to welcome Professor Joseph Soong, who is Vice-Chancellor at the Chinese University of Hong Kong. We are here today at the Royal College of Physicians because this evening Professor Soong is delivering the Lilly Lecture. The title of his lecture is From SARS to Influenza, Reflections of a Physician on Leadership. So this is a very appropriate time to meet with Professor Soong. Professor Soong, welcome and thank you very much for coming to speak to me today.
It's a pleasure.
I always start this interview series with a simple question, which is, what made you become a doctor? What drove you towards medicine as a career?
I remember when I was a teenager, I lived with my grandparents. At the age of around 14 or 15, my grandfather suddenly developed an acute condition, which obviously now I know is hematemesis. He vomited a lot of blood from his stomach, and the blood filled up the toilet, the kitchens, and so on. And I was the only person to be around with him. I was horrified, so I have to call the ambulance to take him to the hospital. And while in hospital, he was very sick. He was then seen by a surgeon who, after doing some tests, found that he has a stomach cancer. And as a teenage boy, I have no idea what gastric cancer was and no idea about the treatment. But I was paying attention to what the surgeon said to my grandfather, and how he made orders to the nurses and how he kept the situation under control. And I thought, wow, this is something very impressive, and if I grow up, I would like to deal with situation like this to take care of people who are very ill and calm the family and calm the patient, and if possible, give them the necessary treatment. So I think that was the first time that I was really attracted by this profession.
And where were you brought up? Was it in Hong Kong?
Yes, I was born and brought up in Hong Kong. I got my graduate degree. I graduated from the University of Hong Kong. And then I received clinical training at the Prince of Wales Hospital, and in those days Hong Kong was still a British colony, so we followed the British system of education and postgraduate training. So I took my MRCP exam.
Now, one of the things I've been impressed when reading about your work is how keen you are to achieve a good balance in academic life between education and research. But I'm also aware, and I'm interested that your first exposure to medicine as it's practiced was in gastroenterology, because I know that you're a specialist gastroenterologist with a very heavy clinical load, and certainly in the past. And I wondered how you managed to create time for the activities of education and training, as well as for research and clinical care and service.
Well, I must admit that in the early part of my career, under training or after I become an academic staff of the university, I focus more on research. We spend a lot of time in providing service to patients, and during consultations and doing procedures and doing ward rounds, we have a lot of opportunities to take up problems and conduct our research accordingly. And at that time, as a young physician and a young academics, we were all very keen to publish our paper, to get our research grant approved, and to give a talk in a big medical conference. That sort of thing was really driving us. And after about 5-6 years, I gradually realized that one person cannot do everything. And at that time, I was a young chief of gastroenterology in our hospital, and I started to build a team of people. Those are fresh graduates from our medical school, and I try to entice the best graduates to come to do gastroenterology and assign them to different subspecialties like hepatology or endoscopy and so on. And I spent about 5-6 years to build a team. And then there comes to a very important turning point in my career. And that was in 2003 when, at that time, I was head of medicine in our hospital. And we had an outbreak of an infectious disease which we have never come across. We have no idea what sort of infection it was, but just happened that it was a major outbreak right in our hospital, right in my department.
I heard that during the SARS outbreak that you essentially became resident in the hospital, never left.
Oh yeah, well, we have no choice at that time
So
because we,
Yeah.
before the isolation policy was implemented, we already felt unsafe to go home. So after the outbreak, on day one, I went home and very late at night, and I had a quick supper and took a shower, and then I took some clothes and I told my wife that it's probably not right that I stay here because I might be bringing some germs that I have no idea about. So, and then that was the last evening that I spent at home for the whole period of about 3 months.
Have there been any people who have acted as your mentors, rather as you are now, obviously as a mentor and role model to others? Are there people that you think back on and say, that was a turning point in my sort of career decision, that contact?
I was lucky enough to be a student of Professor Sir David Todd, who was Professor of Medicine at the University of Hong Kong when I was a medical student and a young doctor. Sir David is a hematologist, but also a very competent general physician. So he basically teaches everything in medicine, from neurology to hepatology to infectious disease. But what he impressed me most was his dedication to patient care and also research and education in medicine. I remember when I worked as an intern in Queen Mary Hospital, on the first day, Professor Todd came to the ward and see us as new interns. And he said, don't ask me what is the working hour in this hospital. We don't have working hours. You have to stay here as long as the patient needs you. Of course, that was a very tall call, and we were very surprised with what he said on day one. But I think it really shows his commitment, and he emphasized on professionalism in our career.
How do you manage to have some time for yourself when you have such a demanding vocation and career? How do you achieve a good work-life balance?
To be honest with you, I don't think I can keep a good balance. But I think I do not see my work as work. I see it as part of my life, and I enjoy that part of my life. Which means that I would never check whether this is 5 o'clock or 6 o'clock, whether I should go home now and do something else. If I have something to do, I would just stay there and until I'm done. And I take enjoyment in my work. I think that is very important. But obviously, you should also spend time with your family and spend time with your friends. I was once given this interesting parables, if you like, and that is, life is something like a person playing the balls in the air. So in our life there are 4 balls, One is your career, one is your family, one is your health, and one is your friends. And among these four, only your career is plastic. The other three are actually glass balls. So it means that if you drop one of the glass balls, you will never get it back. The only one that when you drop it, and it might still be able to bounce back and you can start playing again, is your career. So don't sacrifice your family or your health for that. You have to sort of set your priority and, if possible, keep a balance.
That's wonderful. Thank you very much, and I really look forward to hearing the lecture this evening.
Thank you.
Thank you again.